Elsewhere, the government is exploring new ways of training households on how to care for asymptomatic COVID-19 patients as the number of infections in the country remains on a steady increase. The number of cases shot up to 28,754 after 650 more people tested positive for the virus in the last 24 hours. Nancy Okware with the latest statistics.
On Thursday, Kenya marked 154 days since the first coronavirus case was reported in March. This coming as the country's coronavirus caseload jumped to 28,754 after 650 new cases were confirmed from 6,768 samples tested. Health Chief Administrative Secretary Dr. Mercy Mwangangi announcing 490 new recoveries, out of which 308 were from the home care program and 182 from health facilities.
This is a program that was being celebrated yesterday across Africa. We had people from Ghana, South Africa really trying to find out what are we doing, how are we doing this, how are we getting success from this program.
Even though our recovery rate lags behind the global average, this is just because of reporting like today. The figures we have given to you are basically reports of discharges from 23 out of the 47 counties.
So far, the ministry said the home-based care program has been a success as it accounts for close to 60% of the recoveries, and that over 34,000 community healthcare workers had been recruited, with plans underway to train household members in a bid to further increase awareness and ensure treatment at home.
And so we shall explore and see, do we have an online module, a modular format, where you're able to see how do I clean my dishes when I'm having home-based care? How do I prepare 0.5% JIC? That's an important component of home-based care.
4 more patients succumbed to the virus, pushing the total of fatalities to 460, with Kenyans urged to seek medical attention whenever they feel unwell.
When you have a normal flu and you're at home, sometimes you're able to weather that and take care of yourself. But when it comes to a point where you're having difficulty breathing, you're having a high fever, it means you're somewhere in that tangent where you would require some form of care in a hospital setup. Where
your lungs are already affected, and ordinarily you would be having difficulty in breathing, but for SARS-CoV-2, you have very low oxygen saturation levels, but you otherwise appear well. But when you land in the hospital, you're taken straight away to the critical care unit. So it is important that as soon as you start feeling these symptoms, you get hold of your healthcare provider to seek for assistance before a lot of damage is done.
Nairobi accounting for the biggest chunk of total confirmed cases with 17,135 cases, followed by Mombasa with 2,196, Kiambu 2,131, Kajiado 1,595, Machakos 1,041, while Busia had 885 cases. Nancy Okware, Channel 1 News.